there have been a lot of effort in understanding the factors that may drive progression of smoldering myeloma to active myeloma requiring treatment. And that's where also there is research that how can we prevent that progression. So a lot of studies have been done. There is the most recent is this 2220 classification utilizing not genomics, but other laboratory data to identify high-risk myeloma, which has a higher chance of progressing to myeloma compared to the rest. What we have performed, Anil Akhtar Samur in our group presented at ASH, was first did whole genome sequencing and RNA sequencing on very precious sample. These were samples collected from patients who had smoldering disease or MGUS, and the same patient sample when they progressed to myeloma. So these are what we call progressor myeloma. And then we had samples from patients who did not progress for 5 years or more. So they had a better risk myeloma. And she compared both of these groups, those who progress, those who did not progress, and those who progress, what it changed to. And if I summarize all the data, she has begun to identify the drivers of progression, but more importantly, the drivers that keep this good risk myeloma, in a good risk smoldering myeloma into smoldering stage and not progress. Now, one of the things that we had published earlier this year was what is called genome scar score. That sort of says how unstable is the genome. And using the genome scar score in Journal of Clinical Oncology, we published showing that a low GSS or genome scar score predicts for those myeloma patients who have a good outcome. So this was for myeloma. Now she applied the same principle and algorithm for smoldering myeloma and reports that smoldering myeloma patients with low genome scar score have less likelihood or a good risk smoldering myeloma and has less chance of progressing to myeloma. And so she has proposed the first algorithm to begin to define patients who may be low risk myeloma. And this is where we may do different approaches. We don't need to treat them like myeloma. We may treat more like MGUS. We can have a preventative immune-based and other intervention to totally prevent any chance of progression.